Hello, my name is Zach Kraus, and I am the current president of our local SNPhA chapter here at Cedarville University, and I'm also the chair of our Prescription for Service Committee. Our committee is excited to showcase a project that we've been working on here for the past 2 or 3 months, which is our SNPhA's Shots on the Spot program, which is a collaboration with our local community pharmacy, Cedar Care Village Pharmacy. This video is intended to give you an overview of what we plan to do within the project, as well as how funding from the Prescription for Service grant would allow us to continue the project into the following year. As we all know, because of COVID-19, the need for vaccination and access to vaccines has increased exponentially over the past 2 or 3 years. Access to vaccines like the coronavirus vaccine, but also others like flu and pneumonia, is incredibly important not only for keeping patients safe, but for general public health. Here, where we're located at Cedarville University, we have a limited number of pharmacies that are available due to the rural access, and many patients who struggle with transportation issues that make it difficult for them to get to clinics and pharmacies where they can get vaccines. Our program is a partnership between our chapter and Cedar Care Village Pharmacy, which is a local teaching pharmacy attached to our university. Our program is supported by the pharmacy staff, which includes their current pharmacy director, Dr. Justin Kobe, as well as their community care fellow, Dr. Martha Abraham. Both Dr. Kobe and Dr. Abraham are willing and able to help us with our recruitment of preceptors and students, and also with keeping up with inventory requirements that the pharmacy can order in order for the program to continue. Our intent is to work with the current program that's already running in the pharmacy for prescription delivery, where patients are able to get their prescriptions delivered to them free of charge within a certain radius of the pharmacy. Our program would utilize the van that the pharmacy currently has and have vaccines delivered directly to people's homes, where pharmacy students and pharmacists would administer them without people having to leave their homes. The funding from the Prescription for Service grant would allow us to have longevity and education integrated directly into our project, with funding that would allow us to purchase more materials such as PPE, Band-Aids, alcohol swabs, and the vaccines themselves directly for utilization of the pharmacy, and would allow us to integrate things like educational pamphlets and handouts that we could give to people explaining not only what vaccine they're using, but also how vaccines and general preventative health measures can increase and improve patients' lives overall. In order to showcase what this program is and how effective it's been, we have a proof of concept with a trial delivery period, which we carried out over the December of 2021 month, and found a lot of great success with the 2 different patients that we were able to help as a result of the project. Since that project happened in December, we've had multiple patients calling into the pharmacy trying to see whether or not we're going to implement those kinds of services directly into our workflow, and whether or not that's something that they can access. Our hope is for this project to be a great opportunity for students and pharmacists to collaborate together, with pharmacy preceptors allowing pharmacy students to get experience not only administering and counseling on vaccines, but also talking specifically about the public health benefits that they have. Preceptors will be able to watch students and help them with their administration technique, and will generally teach them about the ways that the students are impacting public health. This is also the first of many steps that our pharmacy here, Cedar Care Village Pharmacy, hopes to implement in order to improve public health in our community, and it's one of the most innovative systems that we have in our area. The end goal for the pharmacy is to eventually work on a mobile unit in general that has more extensive and more comprehensive health services available that can go out directly into the community and offer services in addition to the vaccine services that we're already offering. So that is an overview of our Prescription for Service project this year, SNPhA's Shots on the Spot, and we are really excited about the potential of having funding from the Prescription for Service program to allow us to give this to our community. Our email is in the top corner if you have any questions for us or the rest of the team. Thank you.